old man fall onto the outer stretched hand. On examination, there is tenderness in the anatomical snap box. So the anatomical snap box, it has both the anatomical and pathological or clinical values. However, forearm and the hand X-ray are normal. That means there is no fracture or no deformity in the hand and forearm. And what is the most appropriate course of the action? That means a patient goes outer stretched hand, there is tenderness, is anatomical snap box, X-ray, forearm and hand are normal. What is the most appropriate course of the action? Here, as it is the tenderness present, definitive tenderness present, so there is a chance of the fracture of this area. So the options are discharge with reassurance, place a arm sling and discharge, place a futura splint and review in fracture clinic, admit for surgical exploration and apply for external device. So first of all, let's see, this is the anatomical snap box. Actually, this is the anatomical snap box, and either side of the anatomical snap box different type of tendon pass. And this anatomical snap box is very important, because the base of this anatomical snap box, there is a bone which is the scaphoid. So scaphoid bone are located in this anatomical snap box, and here we can see there is giving pressure by the finger in this area, and when there is tenderness present, then it is the scaphoid fracture is present. So in case of scaphoid fracture or suspected scaphoid fracture, what we have to do? Here you can see this is the scaphoid bone, and it is located at the level of the anatomical snap box. And here are different type of the fractures, such as the proximal fracture, waist fracture or middle fracture, and distal fracture. So 3 types of fracture present. So let's see what is the scaphoid fracture. The scaphoid fracture should temporarily immobilized. Why immobilized? Because there is a chance of development of AVN, that means avascular necrosis, because it's the blood supply, it goes from the proximal to distal area or waist area. So when there is a fracture, there is a chance of development of the avascular necrosis. So we have to immobilize as fast as possible, to prevention of the secondary arterial injury and to prevention of the AVN, that means the avascular necrosis. And then on to 2 weeks later, further review should be done by the X-ray, and futura splint will immobilize better than an arm sling for this problem. That means futura splint is very essential for scaphoid fracture. So place a futura splint and review for fracture clinic. And we should not discharge only reassurance, because the only one reason which is the chance of development of the avascular necrosis, that means the AVN. And arm sling and discharge. Arm sling, when giving the arm sling, there is resting of the hand, but not the resting of the scaphoid region, especially the wrist joint. And admit for surgical exploration. Surgical exploration is not the primary treatment of the scaphoid fracture. An external fixator device usually is not placed here. Actually, the external fixator device, they are placed in area when there is a open wound, and in open wound there is external fixator device is applied.